So if you take this risk assessment test and you get above 20%, what are you supposed to do? And why is 20% the marker?
So our lifetime risk as women in America is 13%. Once it's above 20%, that means we want to be more proactive to find it, because we might not just find it if we only do the annual screening tests. So the supplemental screening typically would be a breast MRI. And then going forward, you would do a mammogram and ultrasound once a year. 6 months later, you would do an MRI, which would also be once a year, so that essentially at every 6 months, you'd be getting something surveilled, so that if we find something, we're catching it early. The insurance company might still very well say no. And then you pay for it yourself or you don't get it done. And you and I both know in this country what ends up happening. A lot of people do not have the resources to get it done because it is not an inexpensive test. So one way around that, some of us find, and this is again depending on the resources in any demographic area, is that if we send a patient to a breast surgeon, which are specialists who only operate and take care of breasts, they are often the ones who also do screening programs for patients at risk. They do physical exam as well as sending people for these tests. And they're sometimes able to get this covered differently with the insurance companies because they're able to write more aggressive letters and things like that. But it is a common problem.